Welcome to the deep dive. Today, we're digging into your sources on this whole stick-on wellness thing, the transdermal micronutrient patches. Our mission is really to see, is the buzz justified? Is it solid science or mostly just convenience?
Well, the convenience factor is huge, absolutely. You see companies popping up like the Patch Remedy in Australia, founded just back in 2021. And their marketing really hits those key points. No swallowing pills, which some people hate or can't do easily. Easier dosing, supposedly.
Right, and the big one bypassing that first pass through the liver.
Exactly. The idea is that nutrients don't get broken down by the gut and liver straight away. Instead, you get this slow, steady release. Things like B vitamins, magnesium glycinate, curcumin, over hours.
Okay, and we know transdermal delivery itself isn't like science fiction. It works.
Oh, absolutely. It's
Right.
proven technology for certain drugs. Think nicotine patches, some hormones, scopolamine for motion sickness. Those have been around for ages. They work because the molecules are generally small enough.
So if it works for drugs, why isn't it a slam dunk for vitamins and minerals? Why can't they just, I don't know, pack more punch onto the patch? Is it cost, or is there a real physical limit?
It's mostly about the delivery limits. I mean, fundamentally, your skin is a fantastic barrier. It has to be, right?
Keeps the outside out, inside in.
Pretty much. For something to just passively soak through, the molecule usually needs to be pretty small, generally under 500 Daltons in molecular weight.
And many vitamins.
Well, many vitamins and minerals are bigger than that. Or they don't have the right properties, like being fat-soluble enough lipophilic to easily cross that fatty outer layer of skin. So it's a real hurdle.
And when you look at the actual human studies on these supplement patches, it seems like the skin is, well, doing its job maybe a bit too well.
Yeah, the results haven't been great, honestly. There were a couple of trials with post-op gastric bypass patients, people who often need supplementation.
Okay, what did they find?
They found that the patients using multivitamin patches were actually more likely to end up deficient in at least one nutrient, especially things like vitamin D, B1, B12, compared to those taking standard oral supplements.
Wow, so more likely to be deficient, not as good as.
Exactly. In those specific high-risk groups, the patches seemed suboptimal. And it's not just that study. There was another one with endurance runners looking at iron patches.
Let me guess, not great results either.
You guessed it. The iron patch group showed basically no improvement in their hemoglobin levels. The runners taking oral iron, though, they had significantly better ferritin levels. That's your iron storage marker by week 6.
Okay, so the current stuff on the market might have some significant limitations, but what about the future? There's always new tech, right?
Definitely. And that's where things get, well, potentially more interesting. We're talking about ways to actively push nutrients through the skin, not just letting them passively soak.
Like what? Needles.
Sort of. Technologies like microneedle erase tiny, tiny needles you barely feel to create microchannels. And also things like iontophoresis, which uses a very mild electrical current to help drive compounds across the skin barrier.
And does that work?
In lab studies, yes, quite impressively sometimes.
Yeah.
There was one study, an ex vivo one, so using skin samples, not live humans yet.
Okay.
They combined microneedle pre-treatment with iontophoresis for iron delivery. And they saw like a 44-fold increase in iron uptake compared to a standard passive patch.
44 times, that's huge.
It sounds huge, yeah. And this is the crucial part, that the researchers themselves are very quick to point out that these are lab results. We still need solid proof it works effectively and safely in actual humans in real-world conditions.
Yeah.
That research is still pretty early stage.
Right, which brings us neatly to the whole safety and regulation side of things. When you have these new delivery methods, especially in the less regulated supplement space, you need to be careful.
Absolutely. Look at the warnings the FDA issued recently. Not about patches, but about compounded versions of those popular GLP-1 drugs for weight loss, like semaglutide.
What was the issue there?
Multiple issues, really. Concerns about unapproved ingredients, like using different salt forms of the drug semaglutide sodium or acetate, whose effects and safety profiles aren't fully known when compounded like that.
So quality control, basically.
Quality control, yes. But also things like improper shipping and storage. These drugs often need refrigeration, and reports of dosing errors, fraudulent labeling. It's a reminder that when you step outside the standard, approved pharmaceutical path, risks can increase.
And that applies just as much, maybe even more so, to something like a supplement patch, where the oversight might be even less strict than for compounded drugs.
Precisely. The takeaway for you listening is, know where your products come from. Check labels carefully. If it's meant to be from a pharmacy, verify their legitimacy. If quality control can be an issue for relatively high-profile compounded drugs, you really need to be vigilant with newer, less established wellness products like patches.
So, summing up this deep dive, where do we land? It seems like there's this real tension, doesn't it?
Yeah, definitely. On one hand, the convenience is undeniable. Stick it on and forget it. That's appealing.
But on the other hand, the actual scientific evidence for micronutrient delivery through many current patches, it's limited, often based on animal studies, lab models, or human trials showing they just don't perform as well as traditional oral supplements, especially for some key nutrients.
The skin barrier is still the major roadblock. And while those next-gen technologies like microneedle sound promising, they're largely still in the research phase for this kind of application.
Okay, so we need caution, but let's leave folks with something more to think about. You mentioned something interesting from animal studies earlier.
Right, this was kind of fascinating. Some animal studies looking at iron patches suggested that absorption actually improved if the animal's dietary iron intake was reduced.
Wait, so eating less iron made the patch work better?
Seemed that way in those specific studies, yeah. Which raises a really interesting, maybe provocative question for the real world, doesn't it?
How so?
Well, if how well these patches work might depend on what you're eating, the very source of the nutrients you're trying to supplement. How does that impact long-term use? Our diets aren't perfectly consistent day to day. So what does that mean for reliable dosing and effectiveness from a patch if your own food intake is constantly changing the equation?
Huh. That's a really good point. Compliance isn't just about remembering to put the patch on. It might be tied to your plate, too. Definitely something to chew on.